Well, we're at the live Q&A session now. Right after my introductions, we'll go live. Jeff Hall is joining us. Jeff, welcome back. Thank you. We introduced Jeff earlier, so let me introduce the other panelists we haven't introduced yet. And let me start with Kristina Derro. Kristina is an attorney at Legal Help for Veterans. She focuses on veteran disability claims with the VA. She's got, we won't say how many years, decades of experience, and she is an expert in this field, recognized locally and nationally. She's a member of NOVA, which is the National Organization of Veteran Advocates, where she's an active participant and on committees and chairs. She's been the chair of the Oakland County Bar Association Veterans Committee. Her undergraduate is from the University of Michigan, and her master's is from there as well in social work. She picked up her law degree at Wayne State University, and again comes to this. This is her 11th annual Veterans Summit as well, answering your questions, and always one who the listeners and the participants always enjoy. So thank you for being here, Kristina. We also have Michael Smith. Michael Smith serves as the current director of the Washtenaw County Department of Veterans Affairs. Since I always get his title wrong, I wanted to read it right this time. He's been there for over 20 years. He served a total of over 21 years in the Army National Guard and the U.S. Army Reserves, so he has that military background that he brought to this job of helping other veterans get their benefits. Michael's a walking encyclopedia. You'll find that out as he answers your questions later today. He's one of the few people I know who can spout off all the form numbers, so you'll see that happen. He is a past president of various organizations, such as the Michigan Association of County Veteran Counselors, where he was president there for a couple of years. So Michael, again, has joined us numerous times, and we're glad to have him on today's live panel. Also with us is Chris Herman. Chris is a nurse practitioner. We asked Chris to participate with us, and he has for a number of years now, because he has now retired from the VA hospital system. He was down at the John D. Dingle VA Medical Center for about 18 years. So he's a guy who brings not only that medical and nursing knowledge to our panel of experts, but sort of the inside, real way it works down on the floors, down in the buildings at a VA medical center. He did his undergraduate at the University of Michigan. He picked up his RN at Henry Ford Health System. He did his adult nurse practitioner certification. He's also been certified by the VA's Office of Disability and Medical Assessment. He's received a number of awards from the Secretary of the VA, and he's a member of the American Academy of Nurse Practitioners and has received one of their excellence awards. So Chris is going to give you that hands-on practical experience. Every year for 11 years, and really along with Kristina Derro and myself and Ken Community Foundation, one of the founders of this summer is Brigadier General Carol Ann Fausone. The General is a registered nurse. She has a master's in nursing and administration. She served in the military for about 36 years before retiring in 2011. We can't describe all of her background. We don't have enough time, but I think I'd point out that from 2003 to 2011, she served as the Assistant Adjutant General of Veteran Affairs for the Department of Military and Veteran Affairs in the state of Michigan, advocating for veterans. And that's what she's done since her retirement from the military in 2011, is she's spent the last 9 years being a veterans advocate and helping at Legal Help for Veterans, where I refer to her as the Chief Fix-It Officer, or CFO. So you've got a distinguished panel here that can answer a lot of your questions. And now let me turn it over to Kristina Derro, who's going to moderate the questions for the live panel and hopefully engage in everybody in some really informative and robust discussion. Listen in.
We are going to go live, but let's get started. And I think our first question is, we can go to General Fausone, if you wouldn't mind. We have a question about, if a veteran's wife passes away before him, will she be eligible to be buried next to him at the National Cemetery because she's not in the military?
The answer is yes, but there's a couple qualifications or criteria. He has his DD 214. It was honorable. They have their marriage certificate. And I think the answer is yes. And we've got ebooks out there to tell them all those particulars and everything else they would get. I think the real thing that's really important is to also communicate and for the burial of the veteran, work with the funeral home who is extremely knowledgeable about all of the benefits, including burial benefits and particularly the VA picking up some of the expenses for the burial of the veteran.
All right, great. Next question, actually, Jeff, I'm going to give you a two-parter if you don't mind. The first question that came in is just in regards to your presentation. Do you have to be a member of the DAV to get help with employment through the DAV? And then the second part of that is, what are the biggest challenges that veterans and their spouses face trying to find employment now since we're in the middle of a pandemic?
So the first question, no, you do not have to be a member of DAV to receive any of our assistance, whether it be help with your VA claim, or you need a ride or something like that to and from your medical appointments, or any of the employment assistance that I had talked about through my presentation. So no, you don't have to be a member of DAV. Of course, if you're eligible for membership at some point, we would certainly hope that you would entertain becoming a member and joining our ranks. The second part, a lot of it I talked about in the presentation, but just sort of a recap. The biggest challenges I think that veterans and their spouses were facing still are in many ways during the pandemic was just simply how to go about job searching. The physical component being removed or taken away was something that we all had to get used to. As I had mentioned, I was used to traveling every week to and from career fairs as an example, and that completely halted to going to a virtual. I think it took a little while for the word to get out. In many ways, I think it still has much ground it needs to travel to get the word out. That is, companies, again, they've been hiring through the process and they're continuing to do so. So the challenge is getting veterans connected to that process, whether it be our virtual career fairs or simply them understanding that companies, there's still ways to engage companies, just as we are doing here in this complete presentation, which is probably new for you guys to do it this way. We're all learning how to do business and deliver our services, whatever that may be. Same thing with hiring. So I think the biggest challenge still remains the veterans simply understanding how to go and connect with companies. Our virtual career fairs is just one of those ways.
Chris, I have a two-parter for you as well that came in. The first is, and they kind of go together, can I keep my private sector provider and still use the VA? And then the second part that goes in, one of our chat questions today is it advisable to veterans to have, or for veterans to have a Part D program if the veteran must have brand medications? It's understood that veterans may receive services at a VA facility and obtain generic medications at a reasonable cost. But what way can they then obtain those medications through VA if it's coming from their private provider?
In answer to the first question, can you keep your private insurance and use your private providers? Yes. Many veterans use both. When I was in primary care, I frequently co-managed many of my veterans with their primary care providers in the private sector. We would coordinate care and I would work with their primary care providers or their providers in the private sector as long as I had the information. One thing that is important when you are using both the VA providers and private sector is that you assure that the VA has the information that you get from your private provider. And in the day of electronic medical records, that's usually pretty easy. An example is when you, let's say you're seeing a cardiologist. Anytime you have a test done, such as an echocardiogram or any other type of procedure, ask for a copy of that from that provider and bring it to your next visit with the VA provider. And that way the VA doesn't have to duplicate services, and everyone's on the same page. This can also be done if you're using My Healthy Vet to communicate with the provider at the VA also. And you can share services. Sometimes it's cheaper for you to get prescriptions through the private sector than to pay the $8 copay if your medicine isn't for a service-connected condition. So that's where it becomes important for you to be a smart prescription consumer. Check and see which is cheaper. Is it cheaper to get it to the VA, or is it cheaper to get it through your local pharmacy with your current insurance? This ties into the Medicare Part D. It is difficult to answer the Medicare Part D without knowing how much your prescription costs are. I recommend, which I have with many of my vets, and I've done myself while I'm not a veteran, I've had to look at my prescription cost and then shop around to find out where I can save money. You have to realize CVS and Walgreens are out there to make a profit, so keep that in mind. So ask what the price is for this medication. Work with your providers. Are generics just as effective? Some are just as effective, some are not. And if that's the case, then the VA has to determine if the research and science supports the fact that a brand name is better than the generic. We've done that in the old days with some forms of Coumadin. There were some generics that were not as effective, and that has to be based on good science and research. Certain new medications used to treat specific conditions, and all the new blood thinners that are out, if you've had heart stents or certain heart things, heart conditions, you may be a candidate for that, but your VA provider is going to have to submit a special request for what's called non-formulary or a higher tier medication. And you can work with your private sector provider and your VA provider. There is a way to do it. But I want to reinforce you have to do your homework as to where it's cheaper. So there's plenty of prescription assistance programs out there. I don't have any stock in Kroger, but I have saved probably $1,000 a year using the Kroger Pharmacy Savings Club. I'll use an example. My Advir for my asthma, if I went through Blue Care Network, it's $250. If I go through Kroger Pharmacy, it's $20. I like to have an extra $230 in my pocket. So you need to do your homework. So I hope that answers your questions.
We do have a question on VA mortgages, but it's pretty specific to the veterans' own circumstances. So he did provide us with an email. I'm going to reach out with him afterwards to put him in contact. Actually, Michael, that's going to be you. So you're going to be getting the email to be able to answer his question on the mortgages after this, so you can be a little bit more specific with him. But I do have a question for you, Michael, in regards to monthly disability payments. A veteran wanted to know if his wife is entitled to survivor benefits of his monthly benefits if he dies before her. So can you maybe explain the different scenarios where that could possibly, work out for them?
Yes, thank you, Kristina. So When we talk about, and a lot of veterans are concerned about whether or not their survivors are going to receive a portion of their disability compensation. And actually, no. So let's just say that outright. They will not receive a portion of the veteran's disability compensation, but there is a benefit to survivors called dependency indemnity compensation. And there are several ways by which a survivor can be eligible for that. The one is if a veteran unfortunately passes away as a result of a service-related disability, regardless of the percentage. A veteran can be 0% service-connected for a heart condition, and if that veteran passes away as a result of that heart condition, that survivor is going to be entitled to dependency indemnity compensation. One of the other ways that a survivor can be entitled to that benefit, which we affectionately refer to as DIC, because dependency indemnity compensation is a mouthful. The other way in which a survivor can be entitled to DIC is if a veteran has been service-connected at the 100% rate, permanent and total, for a period of 10 years or more. And if the veteran passes away from any medical condition, even a medical condition not related to military service, that survivor will be entitled to dependency indemnity compensation. That rate right now is a little bit over $1,300 per month. So it's not, if you can imagine a veteran receiving the 100% rate with a eligible dependent spouse, that rate is going to be about $3,000. So for that survivor, it's going to be a little bit less than half of the entire 100% rate. Yet, there's another benefit that we like to always highlight for those who are eligible for DIC, and that we call the 8 and 8 rule. And that's this: if a veteran was service connected at the 100% rate, permanently and totally disabled for a period of 8 years prior to death, and that surviving spouse was married to that veteran for that same 8-year period, they will be also eligible for an additional monthly benefit on top of the basic DIC rate, which brings it up to close to $1,600 per month. And if they're in regular need of aid and attendance, meaning they need the assistance of another person for activities of daily living, they could also qualify for an additional benefit based on the need for aid and attendance.
We talked about the DIC benefits. We've also talked about burial benefits. Can you also go into the aid and attendance benefits, but the non-service connected pension portion for the spouses? If you could kind of give a brief overview on that, since that's income-based.
Yes, there is another survivor benefit that's called survivor's pension. Now, survivor's pension is similar to the veteran's pension in that the VA pays that benefit under 3 categories. There's a survivor who needs the pension because of a lack of income from other sources. Then there's a survivor who the VA is considered or is considered by the VA as being housebound. And then there's a survivor who's in need of aid and attendance, meaning that they need either an in-home care provider, they need to be in an assisted living facility or a nursing home facility, or in essence, a protected environment, and receive the assistance of another person for any of the activities of daily living, such as medication administration or medication reminders, bathing or personal hygiene, cooking, feeding, ambulating, dressing and undressing, transferring from sitting to standing, or standing to sitting, or assistance with their financial obligations. This is an income-based entitlement. The VA has what's called a maximum annual pension rate for every one of those 3 categories, either a surviving spouse who's in need of the survivor's pension because of a lack of income, or a surviving spouse who's housebound, or the highest allowed maximum annual pension rate is for a survivor who's in need of aid and attendance. It's that category that we really like, because under the other categories, the VA will consider certain medical expenses, but they're not really enough to get that person's annual income below the maximum annual pension rate, because the pension is not a lot of money. It is income and asset based, meaning the VA considers income from all sources, including Social Security, as well as any assets like bank accounts, savings and checking, any retirement incomes from other sources, any investment or dividend income from stocks or bonds. So if a surviving spouse's income is above the maximum annual pension rate, yet he or she has to go out into the market and pay money out of the pocket to secure their medical need for aid and attendance, the VA counts that expense along with any medical insurance premiums or healthcare insurance premiums, and they will reduce countable income by the amount of money that they pay out of pocket for that medical need for aid and attendance. And in most cases, it gets that survivor's income below the maximum annual pension rate or all the way down to zero, where then in that instance, the VA pays the maximum monthly benefit for a survivor in need of aid and attendance.
General Fausone, can you kind of piggyback? I know with your position at the Michigan Department of Military and Veterans Affairs Agency, hopefully I got that right. I always forget all of the listing of it and everything. Can you talk about state veterans homes? I know that Ms. Zarbi discussed it a little bit today, but can you go into a little bit more depth? Are there state veteran homes in every state? Is it just in Michigan? You know, how is that working?
The state veterans homes are in every state. And what a great opportunity for veterans. And as Zenita talked about it, when I was at the state, we only had 2, and we tried, as Michael knows, we tried many times to put out, the proposals to develop 2 or 3 additional veterans homes in the locale of where the individuals lived. I would always get the calls from the wives on the east side of the state who said, it takes me 8 hours to get to Grand Rapids. And how do you visit somebody, in a day? And you can't do that. So the state veterans homes are a treasure. Some states, like down in Florida, I believe they have 11 now in Florida. And it's a funding issue. It's a state funding issue. But they are awesome facilities to take care of veterans, whether they're in the activities, the health care, the needs are ranging all over the board. Now, we were very fortunate at Grand Rapids to have a domiciliary unit. And in my days, I think I remember we could house as many as 40. So you think about men and women, predominantly men, who would have a place to live. They would have food. We assisted them with trying to get employment. So I don't think enough people pursue the opportunity of the state veterans home. And they shouldn't be treated as nursing homes, but they're a great place to get care. And I look at it as start and think about a village. You could go into there and you could be very independent and then need additional care. But they are great facilities, and no matter where you are in the country, I will call your Department of Veterans Affairs, see where your veterans homes are located, go to the website of any state. We could call them up right now, state veteran homes. So they are a great resource, Kristina.
And okay, we have a quick question. Actually, I'll just answer it. A veteran's private doctor was stating that he has early signs of neuropathy in his feet and he's service connected for diabetes. And he wants to know if that's a cause for a review of his benefits. And quick answer is yes. Everybody's nodding. We all know it. So once your doctor is starting to tell you that you are getting complications from your diabetes, you definitely should be filing a claim with VA for an increased rating. Peripheral neuropathy is a big one. You'll get diabetic retinopathy where you have problems with your eyes, diabetic nephropathy. Some veterans have erectile dysfunction. There's a whole host of known complications that arise with diabetes. So it's not just making sure that VA service connects you for the diabetes portion, but also making sure that you're compensated for all the known complications. So if you're starting to get those symptoms, you've definitely got to file an increased rating for your benefits.
Hey, Kristina, just to follow up from, in the beginning few questions were all about death and the veteran dying and burial benefits. And Michael, you described, as always, DIC extremely well. But there is something very simple out there that I think a lot of people don't know about. If a veteran dies and there's a claim in process, it's always been said, the rumor, when the veteran dies, the claim dies. False. A spouse should, within 1 year, do what is called the substitution. And so then they will continue to adjudicate, look at that claim as if the veteran was alive, if it gets in the spouse's name. So I just want to point that out, that the claim isn't dead when the veteran dies if there's a dependent.
Okay, Jeff, I have another question for you, please. Especially now, I think in COVID, at least we've been getting some questions from some of our clients. I know that some of the listeners are having it. What about those veterans who may be thinking of starting their own business?
It's an excellent question, one that we're getting more and more about. And I think COVID had somewhat of and I'll just say a positive impact. Maybe somebody was thinking of jumping from their current job into starting that business they've been thinking about for a while. And maybe their current work situation forced them into that situation. So it's not all bad. There are some silver linings in that, to where there are many veterans out there, especially service disabled veterans, that have been thinking about starting their own business, but maybe they just don't know where to start. There's a ton of resources, and I'll tell you one primary resource that is often overlooked, and that is through the Small Business Administration. A lot of people reach directly for the Department of Labor, but the Small Business Administration just has so many, they're very deep in resources and things like that, and answering the most elementary questions that veterans may have. A couple in particular that DAV is involved with are the Institute of Veterans and Military Families out of Syracuse. There's there are other universities that are part of the program, but there's a host of ways you can get involved. And I would simply go to their website, the Institute of Military Veterans and their Families, because they have different programs, whether, they range in different length and things like that. It depends on what the individual needs, how far along they are. Or they just have an idea? Do they have a business plan? How far are they a business that's up and running, but they need additional footing and support, feedback, different things like that. So there's various levels that people can get involved. We've been involved with the Institute of Veterans and Military Families for a number of years, specifically their entrepreneurship boot camp for veterans with disabilities. And we provide a monetary award every year. Now it's called the Vet Edge Conference. In fact, that was the last conference I attended before COVID, was in Dallas at their Vet Edge Conference, and it was a huge gathering. Probably not the most ideal, but I think everything was on the fence of, are we, going to contract this? Am I going to spread it? Whatever the case may be, everything was right at the tail end of coming to a close and people being locked down. But I was really thrilled to be there and offer, a $10,000 award to an individual that's had, he's very successful. He's a service disabled veteran who owns, the company's name is 6 and 20 Distillery out of South Carolina. The guy has a lot going for him in way of his business, and he's a lot further along than some, but at the same time, he still needed that extra push. So DAV was happy to award that to him, and I was happy to be part of that. But there's just a slew of resources that you can get through Institute of Veterans and Military Families. They're a great group to work with. The other one I'll mention, Patriot Boot Camp. It's a much shorter program, but your takeaway from that is much different than a full 6-week program or something like that. Patriot Boot Camp is one where you apply for it, one of their programs. In fact, we were going to be hosting a Patriot Boot Camp here in Cincinnati. It was going to be in October, but we had to cancel that, unfortunately, due to COVID. And we're going to look to do that at a later time. We're also looking at the possibility of doing a 2-day virtual entrepreneurship program. And stay tuned on jobs.dav.org, which is where we will announce that if we're able to get that up next month. Patriot Boot Camp, they take them, they're application based. They take those individuals and they take them through a very rigorous 3 days at their physical events that gives them the tools, the resources, and really what I find as the key, mentorship with successful business owners to those that are out there, corporations, whether it's in the tech industry, finance industry, whatever the case may be. And so for those veterans who are thinking about it, it's probably a good time to be thinking about it. Today, we live in a time where the resources are very abundant for those individuals that want to start their own business, especially for service disabled veteran-owned small businesses. You know, the last point I'll leave on that is there's a lot of veterans that want to do federal contracting. And there is a lot of money available in the federal contracting arena by all means. So DAV, we had done, it's always been of high interest to us to, for service disabled veteran-owned small businesses in the amount of federal contract set-asides that are available. And there's only 3% of federal contracts that are set aside for service disabled veteran-owned small businesses. And, coming up through I've been with DAV almost 30 years. This issue's been alive and kicking for probably as many years. Why is it only 3%? Why isn't it more? And so that's always been a longstanding resolution of DAV that we try to get Congress to push for either a higher amount. And what we have found through that process is accountability is one of the main culprits of why something doesn't work. I think that's just life itself. But federal contracting itself seemed to lack the necessary accountability. We did the first of its kind study. No one has ever studied this particular process. We did that and did a full research study where we got the findings of it at our midwinter conference, which again was about 3 weeks before we went on lockdown for COVID. So we're in the process of compiling that, and that's going to be made available in a variety of ways. But the main direction of that is to take all of the study, pull out the best points of that or the main points of that we can lobby Congress and we can say, hey, this needs to be better. This needs to be improved in way of accountability. There needs to be more, whatever the case may be. That's going to open the door for more federal contracting for service disabled veteran-owned small businesses. Interesting, when we were in DC getting the presentation of the research study that took about the better part of a year, 14 months to get that compiled, as we were getting that at a roundtable discussion, we were actually sitting a week later, the week earlier to the day, the Pentagon had released a statement saying that nearly $1 billion, it was 800 and some million dollars that was meant for service disabled veteran-owned small businesses was actually misallocated to those businesses that were not eligible for that funding. So as we're studying this whole problem and that it needs to be better, the Pentagon releases exactly what we had been kind of feeling, that there was a lot of problems with it. So there's a lot of work to go on that. But all in all, tying it all up in a bow, we have a lot of those resources available on jobs.dav.org that I mentioned, Institute of Veterans Military Families, Patriot Boot Camp, and be looking for more to come on the service disabled veteran-owned small business in the federal contracting circuit. But thanks for the question.
Jeff, if I could caveat on that, here, Michigan, Ohio, and Indiana has Vet Biz Central. Mm-hmm. Vet Biz Central is located in Flint, but it takes care of the entire state of Michigan, Ohio, and Indiana. They are a collaboration between the Department of Commerce, Department of Labor, Small Business Administration, and the VA. And they assist veterans who are interested in establishing their own businesses, specifically service disabled veteran-owned businesses. And they provide sponsorship, mentorship, education, entrepreneurial training. They have an online template where you can actually complete your business plan, and then one of their counselors will go over your business plan with you, locate any potential sources of funding, any potential sources of sponsorship and mentorship. They provide educational and entrepreneurial training around the states at various venues and locations. And then, of course, yes, once you get your veterans owned business up and running, they get you registered so that you can compete for those federal contracts. And
Yep.
you are even on an email list where you get emails from Vet Biz Central for those contracting opportunities for your service disabled veteran owned business. So Vet Biz Central is a huge resource for veterans who would like to pursue entrepreneurship.
For you, what should I do if I have to go to a community ER? And probably the next follow-up would be, how do I get reimbursed when I do go to a community ER?
Those are good questions. And you go to the closest emergency room if it's a matter of life and death. Obviously, VA obviously wants you to go to their ER if you can. But if you do have to go to an emergency room, then within 72 hours, you should notify your primary care provider that you had to go to the emergency room and what you went there for. Also, and I'm going to read from the community care guidelines so I can be specific, and I can provide these to anyone via a link, or I will send them to Kristina and she can provide them for you, but it's a good website to have. So if you're being seen for a service-connected condition, such as you're service-connected for your knee and that knee gives out again and you need to, and so you go to the emergency room, that will be covered in full. If it is for something else, there may be a copay. Now that copay will depend on your benefits and things like that. But then you need to once you get a copy of that bill, you need to make sure you forward it to the VA, the business office or billing, or both, and keep a copy. Also find out who you talked to, who you sent it to, because things get lost. That's just the nature of any business, not the VA. And then they will guide you on that. But in addition to contacting your primary care provider, also contact the business office or billing. Primary care providers have a lot to do. Not all of them are savvy on what to do with that type of thing. I used to document in my charts that when you called me, all right, Mike called me, said he blew out a knee, had to go to the ER. I documented that in the chart just so it's in your chart, and that helps with claims later on. So that's important to know. Let's see, if it's non-service connected, well, just as I said, send that information in. To receive this, you have to be enrolled in the VA and receive care within a VA facility during the 24 months before emergency care. So take a look at that and take a look. The guidelines are care was provided by an emergency department. It was of such a nature that you would reasonably believe that any delay in seeking attention would cause their life or health to be placed in jeopardy. The VA facility wasn't reasonably available to provide care. So they'll let you know how much is, if it's not for a service-connected condition, and you can go to a local VA, it'll save you headaches to go to the VA. So that's what I recommend. So that should take care of it. I hope that answers it. Again, stay on top of it. The local business office or billing. It's a good idea if you are living in the community and using community services that you get to know your VA's billing department. and they can guide you accordingly. Mike, do you have any other, Mike or Jeff, do you have any other guidance on that?
No, I think you hit it all right. And I will just tell you that I get all my care at the VA, and I recently had an emergency situation, and the ER is halfway between me and the VA because I felt that I thought it was a heart attack, and my wife wanted me. She was set on me going to the VA. We received great care. That wasn't the point, but I was like, look, I made that decision the best I could to say, hey, I don't want to travel twice as far but not make it, so just get me in here. And the VA was great. I handled it. They had to keep me overnight. They did all these tests and angiogram and everything like that. And as soon as I was able, just let my primary care know. And, they certainly took care of it. And I'm not going to say that that's representative that everybody's going to have that easy of a time. I do realize, as you guys do, every case can be different, and geography plays a main factor sometimes, unfortunately. But you've given great advice there. And I would just say that crucial thing there is if you or whoever it is, whether it's your spouse or someone with you, a caregiver, can let the VA know as soon as possible. That timing is the biggest thing.
Well, as a nurse in the emergency room a lot, Jeff, what you just said, I want to take it a step back. Whatever emergency room you go into, identify yourself as a veteran or have the spouse identify it to a social worker, your nurse taking care of you in the ER, and that ball needs to start right there. An individual in that community emergency room should be the one that places the call to the VA. They get a number, and it's really efficient, very efficient. And I see the least amount of problems when that happens. For a poor spouse to try to get on the phone and call that special VA number, there is a number, and I want to say it's in discharge planning or social work that you're supposed to call. I don't have it at my fingertips. We could get it as a follow-up, Kristina. But I will tell you, communicate, because you don't want to be hit with a $100,000 bill because you were in the ICU. But through all the good communication, I know veterans had to pay nothing. And so that's the best way to keep that going.
This is going to be a free-for-all. We're going to see how you guys handle it without directing it at one person. Testing you guys out. If you are service-connected and a combined rate of 70%, do you still have an income limit to meet in order to get into a veteran's long-term home?
I got nothing on that.
I'm not really sure I understand what the question is. Maybe, is that the full question? Is it a loaded question?
Nope.
It's a loaded.
Something lost because I would ask, did they apply for TDIU? When you get to 70%, if you're not able to work, that entitles you to other benefits. So I agree, Jeff. I think I'm lost what the questionnaire is trying to get at.
I think I understand.
Okay, good. Michael, you do.
For the VA to provide contracted long-term nursing care for a veteran, they have to be 100% permanent and totally disabled. And their service-connected condition has to be the medical conditions requiring that long-term nursing care. For the veterans' homes, and General Fausone, you can correct me if I'm wrong, I believe those who are 50 to 100% service-connected are allowed to be in a state home for veterans at no cost.
They follow the VA rules, Michael. You've got that correctly. A little different than TDIU because that's 70% or greater. But in the veterans home, I do know they look at income, they do the sliding scale. So they go out of their way to provide a safe and a quality home for that veteran who's applying for the state veterans home. And I would say, to be really honest, we need to look at each case individually and what the veteran is going through at that time, because he or she might not have had the resources to have a Michael Smith in your backyard to even apply for benefits. I knew when we got them to the state veterans home, we would have veteran service organizations coming there a couple days a week to apply for benefits that they never knew they were entitled to. And we got different individuals into the veterans home in some of those conditions. So you just really need to reach out.
I would say that if a veteran who's currently 70% service connected or has a combined evaluation of 70% and is now in need of skilled nursing care because of one or all of those service connected conditions, that would warrant a request for a reevaluation. Yes. Because it's potential that those service connected conditions, now that they are so severe that they require nursing home care, could be increased on the schedule of rating, where the veteran then could be rated at the 100%. And then in that instance, the VA can provide that skilled nursing care under contract in the community.
And in response to both General Fausone and you, Michael, I know I've done many cases like that, where they are, and as you're filing for an increase, also file, as General Fausone said, unemployability for each of the conditions. As a compensation and pension examiner, I have to address each one of those and what the limitations are. And when you yourself go, or when you go with your spouse, and frequently in these cases the spouse is your advocate, even in not these cases our spouses are our advocates, then it's important to document what you cannot do at home, and that needs to be included in that exam. Mm-hmm. And because it's the exam, and your increase is only as good as the examiner's documentation. And I normally don't know what happens after I examine a patient, but with good documentation, it can improve the ratings.
Yes.
So. You're muted, Kristina.
Yeah?
Nope. Yep. Yep.
Okay. We have a quick question that came through upon registration, and I will just answer it very briefly. The veteran wanted to know some information about service-connected hearing loss and how to qualify for hearing aids if you don't meet the VA income requirements. So just briefly, without getting too far into the weeds, in terms of healthcare, there's 8 tiers of healthcare that you can get. There's a lot of criteria that goes into where a veteran would place on the 8 tiers, income base, period of service, awards and commendations, service-connected disabilities, all those things start coming into play. So I believe what the veteran is asking here is if he does not qualify for those, and he needs to rely on trying to get health care in a different way, or hearing aids in a different way, because he doesn't want to pay for them through VA. The other way of doing that is to get service connected for hearing loss. And if you put in a claim with VA and your hearing loss is determined to be service connected, then you get free health care for your hearing loss, and you get then free hearing aids. And that goes for basically any other disability. So once you get service connected for something, you get free health care for that particular disability. And then once you reach a combined rating of 50%, so all of your service connected disabilities get added together, you reach 50%, you then can get free VA health care for whatever disability you have, whether it's service connected or not. So those are kind of nice little numbers and benefits to keep in mind, that If you're service connected for your knee, you go into VA for treatment, you can get a free brace for your knee, you can get free PT for your knee, things like that, because you're service connected. Once you reach the 50% mark, where all of your disabilities combine to be 50%, you can then go in and get treatment for whatever condition you want, and you don't have to pay for it. So that's kind of the short answer for that. In response to our next question, actually, Michael, if you could kind of take over it, it's pretty timely, but how is the VA benefits arm handling extensions for filing deadlines due to COVID? Formal claims, appeals, can you go into that, especially now, not only with COVID, but with the mail that's going on, because it's kind of combined for all of that?
Certainly. So on March 13th of 2020, the VA actually authorized extensions on filing formal claims, filing appeals, and addressing responses to statements of the case or supplemental statements of the case if you are already in appeal. As you know, the VA does have deadlines for submitting certain documentation and claims. So if an intent to file was submitted, claimants have up to 1 year to submit the formal claim. If a veteran receives a denial or receives a decision that they disagree with, they have up to 1 year, again, similar to the 1 year period to file a formal claim. Under the appellate process, they have up to 1 year to file their appeal, whether it's a supplemental claim lane or a higher level review or direct appeal to the Board of Veterans Appeals. And if you're already in an appeal and the VA issues a statement of the case or a supplemental statement of the case, there is a certain time period, 30 to 60 days, by which claimants have to respond. Well, on March 13th, as I said, of this year, the VA authorized extensions for filing anything. If you go beyond the 1 year deadline to file a formal claim, if you go beyond the 1 year appellate period, or you go beyond the 30 or 60 day response period for a statement of the case or supplemental statement of the case, or for submitting any medical evidence related to a claim, the VA will allow extensions beyond those filing deadlines. And what claimants have to do is merely request the extension when they actually do file their paperwork. So if you're beyond the 1 year period to file a formal claim, you merely submit a request for an extension when you do file the formal claim. If you've gone beyond the 1 year appellate period and you engage any one of those 3 lanes that are part of the Appeals Modernization Act, the AMA, you again request your extension at the time that you file or submit those documents. Similarly, when you respond to a supplemental statement of the case or a statement of the case, you can request your extension at that time. In addition, if there are filing deadlines for submission of evidence, claimants can either do it in writing or they can call the toll-free number at 800-827-1000, again, 800-827-1000, and they can request extensions telephonically as well.
Good advice. And we have about 5 minutes left, so I'm going to ask a couple of the last minute questions that were coming in when people were registering and things. But General Fausone, if you can go into, there's actually 2 questions that I think would be best for you to answer. You touched upon TDIU, which is very, very important. Can you also give some of the numbers, the percentage rates for VA that give you like some other extra benefits, with dependents and taxes and things like that?
Sure. So I'll go through a couple very quickly, and I'll start at 0%, because veterans get really upset sometimes. They say, oh my God, I got 0% service connection. Yes, you're not getting any money, but if that condition gets worse, let's say a knee, something, your heart, it's already been proven you got the 0%, it was service connected, and it related to the service. The next big number is 30%. At 30%, you could add dependents, whether you have spouse, children, up till the age of 18. The next one, and Kristina, you alluded to it, it's huge. 50% disability rating gets you health care across the board, not only for that disability, but for any. 70% will get you the opportunity to apply if you're unable to work for TDIU. And then, as we heard from Sania, and we're all aware, you could start to apply for that assisted living, that long-term care that is, as we all know, so expensive these days. When you get to 100%, if you're totaled and disabled, the other thing that we haven't even mentioned is in some states, in Michigan, you could become tax exempt on your homestead. And taxes, as we all know, is huge. And then this is one of the areas that the widow, should you die and you have gotten this benefit, it will continue on with the spouse in the same household, in your same homestead. So those are a breakdown of the numbers and the percentages.
Jeff, another question for you, and I know you went through a lot of this in your presentation, but I think it's really important, and just to kind of hammer it home and maybe go into a little bit more depth. Where can veterans find resources on finding jobs? And then also, in terms of the information that the DAV has available, you mentioned a couple guides during your presentations and things like that. Where can the veterans definitely go to find all of that information?
So the internet, number one, is full of a lot of different avenues people can do in the job search. And again, it gets into a lot of those services that are available in, you know, Indeed, Monster.com, a lot of them that are available that most people know about. In focusing with what we do, we have a job board available, which again, I mentioned during the presentation, but just to take you in a little more information on that, if you go to jobs.dav.org and you click on the Veterans and Spouses tab, and of course, when we originally set that up, it just said for, you know, veterans. And we realized, you know, it was never to eliminate spouses. When you're dealing with IT and things like that, they try to be creative, and they're not really creative because they're IT, right? They're tech people, but they say it's got to fit in this box. It can't be any bigger than this, right? And so a guy like me comes along and says, well, I want it to say veterans and spouses. Finally, we got that because I wanted to make sure that spouses knew that all of our assistance and services are available to them as well. So anyway, click on the Veterans and Spouses tab. And again, we have direct links to companies that we work one-on-one with, whether it be, if you click on Fiserv as an example, it could take you to their immediate job board specific to their company, and a host of those things. The job boards, the job search board that you see there, those are companies that put those jobs in there. They have to pay to put their jobs in there to Recruit Military, our partner. But once those jobs are in there, you can search. And again, you don't have to register. You don't have to do anything. Any one of you right now could go to that tab. Maybe someone contacts you and says, well, apply for a job, you must register. So that's going to be the key there. But keywords are the important thing. And as I had mentioned in my presentation, I used a couple of examples. One being logistics could be broken out into 4 or 5 different or more career paths. So just be creative in what you're searching for. We've had a lot during this pandemic of people that are wanting to search for remote work. Clearly, we're all remote. It's a very important thing, and we didn't get the question that often. What we tell people is, if you're looking for, you know, some sort of job that you can work from home, in the location, put remote. You know, because it doesn't matter if you live in California or Michigan, the job may be somewhere else, but if obviously remote is remote, so it doesn't matter where you're physically located. So just be creative with those things. And again, we're always evolving the types of resources and things that we have available on our website. And I want people to go there at jobs.dav.org and connect with many of those things. The other one I would tell you is go to Recruit Military, our partner. go to their website, recruitmilitary.com. Get registered, get your resume uploaded, because companies go there more than they come to us. Companies go there and search for, if you're in their candidate database, companies pay big money to have unlimited search for candidates, and they'll simply go in. And so if we all go in there right now and upload our resume in there, companies will be able to find us depending on what our career field is. They're going to find us. And that is something I didn't realize in the beginning, that probably more companies search for veterans than veterans searching for companies, if that even makes sense. But I wouldn't have thought it in the beginning, but from the feedback we get from companies, that's true. So make sure, and there's a lot of others, but go to jobs.dav.org, check our resources out, and certainly recruitmilitary.com.
We've been getting lots of questions on healthcare access and things. And so you had touched upon earlier that you can use both private insurance and VA. But can you go into a little bit of a description potentially, and like I said, have General Fausone discuss it too, where if you're at VA getting treatment, are there any instances where you can use private providers? Does the VA ever allow for that or send you to places?
Well, I think the real important thing is, and it's a beautiful new process. It's called the Mission Act. And if you're working with your provider, and if your provider feels, let's say, whatever the issue is, cardiac, dermatology, if he or she feels you need another resource or a second opinion, another way to handle, they don't do it at the, say, the Ann Arbor VA, but down the road at the University of Michigan, they could do this. They're going to extend that and do the referral. So I think there are many avenues, Kristina, out there now with the Mission Act, but you need to keep the VA aware and let them approve you to go on this referral or on this mission down the road, go out of network. Let me just say it, out of network, because then you want the VA to pay for this. You don't want to have to pay out of pocket.
That is very important. I know from personal experience when I worked with the VA, number one, the process is much better in the past 18 to 24 months. But I just spent a week up in the Upper Peninsula where many of the veterans up there depend on VA referrals. And they contact the VA provider, they put in the referral. It's just like any other insurance. And I think our veterans need to understand your VA is an insurance and use it like that. And then they will find a VA, a provider that accepts the VA insurance, and they do the process and they will approve so many visits. There have been some instances that and we'll use General Fausone's cardiology example. You've been under the care of this cardiologist for 20 years. If you ask if you can continue to see that same cardiologist because of X, Y, and Z. He's done all these procedures on me already. He's done this, he's done that. You can see if they'll approve the continuity of care, because that is very important. I'm not saying it will be approved, but you may have some luck with that.
Unfortunately, we are out of time. So I'm going to break now, but there are a couple questions that were asked upon registration, like I said, that were a little bit more in depth. When everybody registered, we got your emails as well. And so we're going to put you in contact with our panel of experts that's going to be best at answering your questions. So that's our goal today, is hopefully to have everybody's questions answered by the specific expert. So this way you'll have the right information to be able to go on. So we will be reaching out afterwards to do that. Like I said as well, we'll be sharing the resources that have been discussed today. And that's it. I just wanted to thank you guys for being our panelists. And I know we have kind of some closing remarks coming up from Canton Community Foundation. the board president. And so we'll just go from there. So thank you guys. I appreciate it very much.
Thank you for having us.
Thank you.
Thank you all.
I wanted to thank all of our speakers and panelists today for taking part in this. It's very much appreciated that they take time out of their schedules and also attempt to do this remotely, which definitely puts another layer of difficulty into all of these sorts of presentations. So thank you to Dr. Kriesman, to Zanetta Adams, to Ann Zerby, to Jeff Hall, to General Carol Ann Fausone, to Michael Smith, and to Christopher Herman for participating today. And then also I'd like to thank the attendees, believe it or not, for coming in. We appreciate you joining us again this year, especially for embracing a new format and also for working with new technology, which I realize is not the easiest to do, but I appreciate that people figured out how to use the chat functions and they were able to log in and hopefully listen. And if you were having problems, again, since we're sending things out by email and also posting it, if maybe your internet went down for a bit and you missed, you know, the presenter that you actually really wanted to hear, you'll be able to still listen to that person once you get the actual links after this has been concluded. So with that, we will just close on down. And like I said, we'll send out all of the information to all of our attendees and everything. I did want to thank everyone for participating today. And if there are any concerns that perhaps we didn't address, if you have any additional questions that maybe popped up after you were listening to presentations, feel free to reach out to us afterwards as well, and we'll be happy to answer those for you or put you into contact with someone who can. And with that, we thank you very much. You guys have a good afternoon. Bye-bye.